and welcome back to my YouTube channel. So my name is Sarah Louise and this channel talks all about scoliosis, spinal fusion and my experience with it. So this video has been a long time coming. This video is my scoliosis story. So to join in with this channel, please subscribe so you can see more about scoliosis, spinal fusion, a bit about me and how I live in my life with spinal fusion now, which I've had for 9 years. So let's get into it. So this video is going to be split up into 6 sections. So we have the pre-diagnosis, the diagnosis, the treatment or monitoring, the surgery and the time in hospital, the post-surgery, so 1 year post-surgery, and then post-surgery being up until now. So we've got 6 sections, so if you're interested in just a specific one of those, you can just skip to that section now, and I will leave all the times of those different sections in the description below. Pre-diagnosis. So pre-diagnosis, I was a fairly or very healthy and active child throughout my like from ages 8 up until like 13. I was a competitive swimmer, so I was really fit. I was swimming basically every day and no one noticed a thing, which is quite interesting to say. I was in a swimsuit most of the time, so it's quite interesting how no one actually noticed my scoliosis at that point. But yeah, I was really fit, really healthy up until probably about 11, 12 years old, where I started getting chest infections. So maybe like the first chest infection, I was going to the doctors, getting antibiotics, and it just wasn't clearing it up, or it was clearing it up, then it was coming back. These were reoccurring chest infections for 2 years, and I never really got rid of the chest infection during that time. So that did cause me a lot of troubles. Obviously, it's hard as a not even a teenager at that age to be quite poorly. But yeah, we managed to get to the hospital, get referred to hospital to have an x-ray on my chest. And then that leads me on to the diagnosis stage. So, the diagnosis stage. So I was diagnosed when I was about 13 years old, and I was diagnosed through the chest x-ray that I got from my chest infections. So after having the chest x-ray, they were not really interested in my lungs, looking at my lungs, because obviously they had noticed my spine, which had an S-curve in it. So following that appointment, I got referred to Leeds General Infirmary. So they have a specialist team there which specialises in scoliosis and conducting these spinal fusion operations. So I met with my surgeon, and at that age I felt like it was quite exciting. I didn't really know what was coming. So yeah, I had my x-ray. They said, right, we're going to monitor this for like 6-month intervals. But at that stage, it was already at the stage where nothing really could be done by like bracing or exercises and stuff like that. It was really thinking about when is the best time to have surgery for me, how long was the waiting list, etc. So I think on my second visit, so 6 months after my first, my scoliosis, my curve had deteriorated, meaning it had got worse. So it had a bigger curve at the top, bigger curve at the bottom, and this is obviously an indication that the spine will continue to get worse as I grow. So at that age, I was nearing the end of my growth spurt, which is when they like to do the operation, because you're finished growing. They know that your spine probably won't get much worse, you haven't got much growth left in you. So yeah, I then went home after that one thinking, right, yeah, I'm probably going to be having the operation. Little did I know I was to receive a call from the hospital telling me that I could go in for my pre-op meeting where they would do lots of tests and stuff on me, and I was like, yeah, great, that date sounds lovely, sign me up. When my parents got home from work, I told them, and we were like, wow, like this is actually really going ahead. So then yeah, I was booked in for my spinal fusion surgery, and that time between being diagnosed and then having my appointment to actually get the surgery was probably only around a month. So they do obviously have waiting lists. I'm based in the UK, so I was on the NHS waiting list, which at that time they said was about 6 months to a year. And they do like to, I suppose, fast track people if their spine needs it more. So yeah, my surgeon was absolutely amazing. He was based in the LGI, which is Leeds General Infirmary, and he did one scoliosis surgery, one spinal fusion surgery a week. So you may think that's a lot or not so much, but I just found that really interesting that he just really focuses on just one patient every week, and it doesn't kind of like overload himself with like so many patients, because I do think it's really important that you get the right surgeon who just has your best interests at heart and really wants the best for you and wants to do the best surgery that they possibly can. And yeah, where you're based, I was based in Leeds, so that was about an hour's drive from my home, so that was quite important. There wasn't a nearer hospital to me, so that worked out quite well. I guess if you're based in America, sometimes you have to do really long distances to find the right surgeon for you or someone who will do your surgery. So the next section is the treatment or monitoring. So the treatment or the monitoring stage. So as I've previously mentioned, my spine had got worse during the 6 months that I had the first x-ray to the second x-ray. By the time that I had these x-rays, I wasn't eligible for treatments. No treatments were mentioned to me in terms of, I know they've got a scroth now, which is like PT, certain exercises, as well as bracing. Neither of these two options were mentioned to me, and to be honest, I didn't even know they existed. I just thought that this is the best option for me, this is the only option for me. So I didn't have any treatment for my scoliosis. I just went straight with the surgery, which may not be something that you personally want to do. You might want to try alternative methods before you go for the surgery, or you might just not want the surgery at all and just try the alternative methods. So yeah, you might not want to have the surgery, you just might want to try the alternative methods. But for me personally, I believe that I made the right choice, but you should definitely go with what your gut instinct tells you to do, what your surgeon thinks is right for you, and also do a lot of research about it and what other alternative methods of treatment that you could have, as one treatment such as surgery isn't right for everyone, and I think that's really important. So in a future video, I'm going to be talking about other treatment methods and monitoring methods and styles. So tune in or subscribe to see that video later on. So this section is my time in hospital or my surgery. So as I've mentioned, I chose the surgery. I believed it was right for me at the time, and I still do now. So my surgery was 9 hours long, really long surgery. I know that they have shortened the time of this, as mine was 9 years ago. But yeah, really long surgery. I had multiple blood transfusions, as obviously you do lose a lot of blood when you're undergoing this type of really serious surgery. So I had an S-shaped curve, so I've got quite an impressive 17-inch scar now. If you want to find out more about my time in hospital, my surgery, I will link the video that I've done talking all about this in a bit more detail. But yeah, I'll just talk a little bit more about it in this video, and you can go and check that one out if you want. So yeah, after my surgery, I had 5 days in intensive care at Leeds General Infirmary. This was a very painful, scary time. I don't remember much. And I think the behaviour for having maybe 3 hours in the day on top of the night and keep that air going down. And what will happen is that will lose you into it, and then you'll have this degree there. Okay, but I think there's not much you can do because but yeah, like I feel like I was in a lot of pain. The nurses there tried to get me up. I think it was the first day after I woke up, they sat me up and got me walking around the ward floor, which was super scary at the time, but it was definitely needed to get up and walking as soon as possible. And then I got transferred onto the children's ward, just to help with my recovery before I went home. So I stayed there for about a week. So during that time, it was just more PT things, learning again how to like go upstairs, and just monitoring like my chest, making sure everything was fine. So my time in hospital was obviously so scary, so painful, but I do feel like I was really looked after, and obviously it's the best place for you. I do know people now that have stayed in hospital even just like 3 days there, and then they're back at home, which I think is absolutely amazing, and it just shows the advancement with the surgery and the advancement with the recovery as well. After my surgery, I remember the surgeon coming to visit me while I was in intensive care, and he showed me the x-rays that I've had done after, so that was with my rods and my bolts in, and he was so pleased, and that just made me happy. My surgeon was pleased with his work, which I just think is so important, because it's their job, it's their livelihood, and they want to do the best job possible. And he managed to get my spine super straight, so it's not really curved at all now. And yeah, my metal work looks great, and I'm so grateful for my surgeon. So that concludes my time in hospital section. But if you are interested, please go and check out that video that I mentioned. The next section that I'll be going on to talk about is my post-surgery, which is up to a year after my surgery. So this section is going to be talking about post-surgery. So from the time that I came out of hospital up until a year post-operation. So within this time, it was obviously really hard. I got back home and I was just trying to motivate myself to move around the house as much as possible, to go on short little walks, just to get myself moving, get my confidence back, as my confidence was really lowered by having this operation. I was scared of everything. I just didn't want to fall or trip and hurt myself. I was very paranoid. So it was really important that I went out with my family. I always had someone there with me to make sure that I was okay. So for the first 6 months following my surgery, I was advised not to do any exercise at all, apart from walking. So I definitely stuck to this. I only went on these little walks, and I didn't push myself too hard at all. I know that this might be different for you, but definitely just take advice from your surgeon and do whatever they tell you to do, I guess. So then it leads up to 1 year post-surgery. So at the 1 year point, I got discharged. So at this point I was allowed to go swimming from 6 months onwards, and then from 1 year onwards I was allowed to do any sport, any activity that I wanted. I was told that I was virtually limitless apart from skydiving. So in this time, this 1 year post-op, I didn't have any physio. I wasn't advised to get any physio. I wasn't given any physio appointments or anything. So I was just left under my own whim, I suppose. So I know that now a lot of people do have physio post-op, and I do think that is really important. And if I could go back in time, I would definitely take that up. So at my 1 year mark, I actually did a lifeguarding course. So this is quite physical. It not only involves swimming, but it involves lifting people out of the water, towing people. So obviously from me doing that at that stage, you can see that I was in a good place. I felt strong enough to do it. I felt like I was able, and I didn't feel like I had any limitations at all. I just felt strong. So that is so great looking back on that, on seeing how strong I felt, how confident I felt. So I hope that gives you some sort of hope if you've just had the operation and you feel like the pain might be never ending, or the limitations maybe never ending. They do end. So the next section that I'm going to be talking about is post-surgery, but after 1 year onwards, so up until now. So I'm 9 years post-op, so that section I'll be talking about that time. So this section is talking about post-surgery from 1 year onwards. So I am now 9 years post-op, and I have struggled, honestly, since having the surgery. I've struggled with pain management, and also adapting to my new body. So in terms of pain, I have suffered with ongoing pain since the operation. This pain is definitely manageable, and most days it is minimal. It's maybe like a 1 out of 10, but it's just kind of like a nagging pain that I just always seem to have. It's definitely not limited my life at all. I've managed to do so many great, amazing things, and I definitely do not regret having the surgery because of the pain. But I think it's really important that I mention it, because some days I am crying because I'm in so much pain. It is like a 9, a 10 out of 10. And I feel like I just need to lay. I need to lay with my legs up. I need to get some sort of relief for my body. And those days can just come out of the blue, and you don't know when they are going to come. Sometimes they came when I was, at university. I might need to take myself home. I couldn't manage with just having painkillers. Those days can be really, really disheartening. But you've just got to remember that most of the time, or some days, you will have such amazing days. So in terms of pain management, as I've already mentioned, in the first year of my surgery I did not have physio, but since then I have been to the physio once, and the person that I went to was a specialist in scoliosis and life after having spinal fusion. So it was great that I had the opportunity to talk to him, and I mostly wanted to discuss my rib rotation and how the rib hump, or the rib sticking out that I have at the back, how that hurts a lot when I'm sitting down, because obviously that is the only part of my back that touches the seat. And I just wanted to see if we were able to rotate that rib a bit more so they were even. So as I actually haven't mentioned this previously, I might have done in one of my previous videos, but with my scoliosis I had the S-curve, but it was also twisted, as a lot of people with scoliosis are, which means that one of the ribs at the front might stick out, and then one of the ribs at the back might stick out. This is because your whole spine is actually twisted, not just curved. So that is something that still impacts me, and that that rib sticking out at the back does actually cause me pain. It's not just a physical appearance type thing that I'm bothered about at all. So yeah, in terms of physio, I've actually only been to see that physio twice. So that was when I was at uni. It was maybe like 2-3 years ago now. And although I haven't been back because he has actually moved on from the practice that he was in Manchester, I have not yet been able to find someone else who necessarily specialises in it where I live currently. But yeah, I definitely say go to a physio, just go and talk to them, even if it's just once, because I still do the exercises that he recommended to me today. So another thing in terms of pain management is exercise. So I myself have gone through phases of going to the gym really consistently for like a couple of years at a time, and then I've really died off it, or maybe just not gone at all. At the stage that I'm in now is I have got a gym membership, but I just go very infrequently. But I do go on at least one walk a day, and I do tend to find that walking really does help me, but you need to be going on the walk before your pain actually starts, because I find once I'm in pain from that day, maybe after sitting at my desk for multiple hours, I cannot get rid of that pain for that whole day. So you need to be moving around before the pain sets in. So another thing in terms of pain management would be painkillers. I do not like to use painkillers really, but I do use them. I only use them when I really need to, and when I'm like crying, I'm in so much pain, which like maybe is like once a week, I'd say normally, that I have to use painkillers to try and reduce my pain levels to make it bearable. But yeah, definitely talk to your chemist or your surgeon, or I know people have these like pain specialists, maybe that's more in America, that really try and control your pain. But yeah, I try and avoid pain medication as much as possible, and do it and manage my pain via exercise, stretching, and not being in a position for too long. So yeah, I am 9 years post-op now, and I can say I do not feel like I have any limitations. There are some things that I just wouldn't do because I don't want to put myself in that position of maybe like causing a twinge or hurting myself, because I don't want to be in pain. But I don't have any limitations, and I am so happy that I had the surgery, and I just hope that you do whatever's best for you. That may be surgery or it may not be. But if you've liked this video, or if it's helped you out, please drop this video a like, and it really helps me out. Or subscribe to my channel to see my journey with scoliosis, with spinal fusion. I have a lot more videos on my channel, so check them out. And I hope you have a lovely day, a lovely evening, and I will see you soon.